Welcome everyone to the Bob and Brad pre-live show. We'll be officially live on camera at 10 a.m. and happy St. Patrick's Day to all our fellow Irishmen. I am part Irish, but not very much. How about you, Adrienne?
None.
Okay.
0. But you're not wearing green and I am.
Our internet just cut us out for a second, but we're back now. Pardon us for interruptions. I don't know where it cut off, but I am here with Dr. Adrienne Tryan today. We are going to be talking about
Bob and Brad, the two most famous physical therapists on the internet.
Hello.
Woo!
Way to restart everything, and hopefully it works this time because we got kicked out 3 times. Anyway, hello to everyone. I'm assuming you already know what we're talking about because I think most of that came through, but we have Adrienne here, Dr. Tryan, and we're going to
Hello.
be talking about balance and the vestibular system, dizziness, motion sensitivity, all explained. And for those of you who are wondering about our giveaway for the week, it is the D6 Ultra massage gun, which I currently have right here. This massage gun is one of our biggest, strongest models, and it comes with this it comes with red light therapy and heat head. That's what makes it the Ultra model. All our other models, the Pro has the hot and cold head, but the Ultra models all come with red light and heat therapy head. Anyway, enough about that. Let's get on to the show.
So what now the problem right now?
Oh, and we apologize because our region right now all has internet issues. So that's why we skipping in and out, but hopefully it'll stay for the rest of the program. Anyway.
And yeah, happy Tuesday. We've got someone tuning in from Chico there. Looks like Diane from Chico.
Diane watches quite frequently. All right, let's get into the agenda for today. So we have, first, we're going to cover red flags of dizziness, when to seek immediate help. Then we're going to go into common causes of dizziness. And then we're going to go into some treatment options for this. If we have time, we might do a little bit of balance activities at the end. But Adrienne has some fun models here for
We've got
us
some
to check out.
fun models. We'll get into these a little later on, but maybe we'll just check them out to start. First, we wanted to talk about the red flags of dizziness and when to seek immediate help for dizziness. And the big thing that I want you guys to think of is sudden onset. So it hasn't been something that's been going on for a while. And typically it's constant. So it's not like coming and going. And then it could be with these other symptoms as well. But even if it's not associated with the next symptoms that we're going to give you, if it's sudden and it is constant, does not come and go, you need to go in because it could be a sign of something as serious as a stroke.
Some other common red flags are sudden and severe headache. So when people often say this is the worst headache of my life, and you are experiencing dizziness with the headache, because obviously, a migraine is a little different, but that could be a big red flag as well.
Absolutely. And then if you've got any sort of chest pain or shortness of breath, any sort of pressure associated with dizziness can be caused from cardiac or heart stuff as well. So you want to make sure that you're getting help immediately with those as well.
Another red flag is fainting or loss of consciousness. Now, I will admit the other week after I cut off part of my finger and had a lidocaine shot, I had my first episode of actually passing out or fainting, which I never have. But luckily, I was ready in urgent care and I was fine. But it can be a serious issue, especially if you're getting dizziness and fainting.
Absolutely. And then also any like new weakness, numbness, or paralysis, that also includes that difficulty speaking, slurred speech, confusion. Those are all signs that it could also be associated with a stroke. And so that's also that like face weakness is included in that as well.
Now, if you're getting dizziness with double vision or sudden vision loss, that is very serious as well. So definitely big red flag, go get checked out.
Yeah. The next one too, trouble walking, severe imbalance and coordination problems. A lot of people, I think, don't always go in right away with these things because they think it's just part of the dizziness. But if it, is part of that, is maybe a problem with the brain, that coordination piece, you really need to go in right away because it could be a sign of something more serious as well.
Also important is if you have sudden hearing loss or ringing in one ear associated with the dizziness as well. That is a big red flag because a lot of this dizziness and motion sensitivity for people that are unaware actually has to do with your inner ear system. So you can get some issues with hearing as well.
Yeah. And sometimes a sudden hearing loss is not a big deal with dizziness, but if it occurs, we want you to go in and get it checked out right away. And hopefully it's no big deal and you'll regain your hearing. But we want to rule out the big bad stuff.
Next is persistent vomiting or inability to keep fluids down. Now, this does, I mean, you work with vertigo people more than me, but this does happen with vertigo at times. People get so dizzy, things just really spin. You can get nauseated
Absolutely.
and throw
I
up.
have people that have difficulty with the nausea and vomiting. But if you're constantly vomiting, you're not keeping fluids down, it's good to be evaluated for that as well. And also, you might just need some fluids, right? So it might be a sign of something more serious, but also it might just be that you need to go in and get some fluids so that you're not getting overly dehydrated.
A couple other things are a high fever and stiff neck associated with the dizziness, because again, this could be more of a head injury type issue. Next is head injury, followed by dizziness. So if you had some sort of fall, or you hit your head pretty hard, you could definitely have a concussion. You can get dizziness with that as well. So you want to make sure to get checked out for that. A couple last two things are irregular or fast heartbeats associated with dizziness. And then obviously if you're having any type of seizure episode, because there could be something neurologically going on that's just causing this dizziness as well, that you want to get checked out. Because, sometimes we work in therapy for people that we think have vertigo and dizziness, but actually they have an underlying problem, which is much more serious. And sometimes they have to go back to the hospital.
Absolutely. All right. So the next thing we're going to get into is some causes of dizziness. And the big ones that we're going to cover today are those inner ear causes. There are a ton of other causes. And we'll touch on each one briefly, but this is going to be kind of our focus. This is a model of the inner ear. And so this is your cochlea here. This is the hearing portion of the ear. And then this is the vestibule. So in the vestibule are these semicircular canals that are fluid filled, and they sense motion with that head movement. And then there are also these two little organs here that have hair cells in them. And those are they're like literally kind of like hair cells that are in fluid. And on the tops of those hair cells, there are these otoconia, which are just like calcium carbonate crystals, which are essentially like, that's what people say when you have like a form of vertigo where your crystals are off. You ever hear people talk about their crystals?
Yes, the crystals in your ears. I often tell people that because I know that much about the vertigo system. And when we're talking about the little hair molecules, they're inside, you can't see them. It's not just, I'm envisioning my grandpa who had very hairy ears. We're not talking about
not that type of hair, no. But in normal function, right, these hair cells have those weights. I call them weights because they literally will bend those hair cells with motion, either up and down or side to side. And that's normal. And then they'll send a message to the brain telling the brain what direction you're moving. But the issue can be is that those crystals actually get into these canals. And that is what we call BPPV vertigo. And that's probably one of the more common ones that is very treatable, that we treat as physical therapists. And then the cool thing, this nice headband that I have, I'll take this
Those aren't
off.
deer antlers.
I'll take this off for a minute. But what can happen is those crystals get into these canals, and then you can kind of see them here. This is like a viscous fluid, right? And so when those crystals are moving through that fluid, they're actually putting pressure on a little cone called the ampulla, right? That fluid is moving and it's putting pressure on there, which sends the message to the brain saying that you're moving. However, you can see here, if this was my head is actually not moving, but those little crystals in there are. You can kind of see that they're just kind of floating in there, and they get pulled by gravity even when you're at rest. And we'll get more into that with treatment, but I just kind of wanted to show with BPPV, and to go through BPPV as well, it's benign, meaning that it's not really dangerous, right? Except that you could fall when you have it. Paroxysmal, which means that it comes and goes. So it's brief episodes usually if you have this BPPV. So it's literally like 5 to 20 seconds of just kind of this really intense spinning sensation. And that's when these crystals are moving or that debris in there moves. And then the other thing the positional just means that it's in relation to gravity, right? The gravity is pulling on those crystals. And then the V is vertigo, which just means spinning.
So we're just going to say BPPV because I can't remember half of that. I have heard of this. It's a pretty common diagnosis, at least what I've seen on people's.
Yeah, and it's
sheets.
usually easily treatable. Like we do 1 or 2 treatments and you are good to go, which is very helpful. And you can treat it at home. And we'll go into that too. It's a little tricky to treat at home because there's 3 different canals that the crystals could be in. And then there's 2 different ears. And so oftentimes if you try the treatments at home, and they're not working, I just say go in. Go get evaluated by a PT because they're going to be able to tell which canal it's in. They'll do testing for that.
The next condition within the inner ear is vestibular neuritis. So this is inflammation of the vestibular nerve causing sudden severe vertigo. So do you have the nerve on there? I'm assuming not.
Yeah, well, there are kind of some nerves, but some nerve models here, right? And so they're kind of hard to see on the camera there. But essentially what can happen is virus potentially is inside that nerve, like inside a nerve cell, and it can cause swelling. And all of this stuff in here is encased in bone. And so if there's a lot of swelling in there, it puts a lot of pressure on that nerve, causing it to not function properly. And so it's not taking the message from the vestibular system and getting it to the ear and vice versa. So it can be like an instant or, it can feel instant, like an instant loss of that function there.
Another condition, I'm going to butcher this one, but I will try my best. Labyrinthitis?
Yeah, I say labyrinthitis, and potato, maybe.
So this is an inner ear infection causing vertigo and hearing loss. So it's more due to ear infection, not nerve inflammation. So is this right behind in the inner ear part? Is this just beyond what I don't even know what it's called, your auditory area?
So this thing, right, this vestibular system and cochlea is right here. I mean, okay, obviously it's not this big, right? It fits on the size of a dime, but it's kind of right behind your ear. So if you can see this bone back here, that is where it is. And so it's not, it's not that inner ear. It's not the part of the ear that you can see, but it's deep inside and it's actually in that bone right behind the ear there.
And the last condition that can also cause some inner ear problems is Meniere's disease. Oftentimes you get episodes of vertigo with hearing loss, tinnitus, or ear fullness.
Yeah, and Meniere's kind of comes and goes. And so it lasts for longer periods of time though. And that's the other thing. So that we didn't touch on with neuritis or labyrinthitis is that those, they come on kind of suddenly, oftentimes with an infection or, it can even be like GI stuff for the neuritis. But you have some sort of infection, you get this dizziness, and it is constant, right? And we talked about that with the red flags. Like if it's constant, go in. And for these things, there are things that they can do like in the emergency room or if you see a primary care provider for these types of dizziness as well. So Meniere's is going to come and go, but it's going to last at least hours, maybe days. Labyrinthitis, vestibular neuritis are going to be constant. And then that BPPV is just really quick bursts of dizziness that are lasting seconds to minutes. Occasionally, it might last a little bit longer, but
I'm just going through our notes here. We do have a few questions coming in related to some of the things. Here. So someone says, is a procedure called Epley maneuver?
Yeah, we're going to go over the Epley as one of our treatments today for that BPPV. So we'll do a Dix Hallpike, which is like the exam and the Epley. So we'll come back to that one.
Rick says, how is cervical vertigo treated? Also, is there a connection between tinnitus and dizziness?
So I always, on my exam, I always ask about tinnitus. And so I think the answer is yes, but it's complicated. And so if the tinnitus started with the dizziness, right? If they like started together, then I usually pay more attention to that tinnitus as part of the diagnosis. But if there is, like, if you've had tinnitus for years and years and years, it could just be due to exposure to loud sounds as well. And there can be other causes for tinnitus as well. So the answer is maybe that they're related. And cervical vertigo can be treated in a lot of different ways, but a lot of the times it's more focused on the muscles in the neck and those, just the muscles in the neck and often even eye movements can help with the cervical vertigo because you are activating muscles in the neck with your eye movements as well.
Do we want to get into some of the treatment options? Seems like a lot of people are curious.
Sure. We can do treatments.
Okay.
Let's see. So let's start with our oculomotor stuff. Hold on 1 minute. I'm going to grab a drink.
If you do have some specific questions, we'll do our best. I have ringing in my ears, Lee says. Well, do you have dizziness as well? Because,
and the ringing is tinnitus.
Yeah.
That's this same thing.
I interviewed an audiologist in our podcast, and he says tinnitus, and I don't know if I've been saying it wrong forever, but
tinnitus.
Yeah, he's been saying it. So I've heard it both ways, but tinnitus and tinnitus, I believe, are the same.
And then there are treatments for labyrinthitis. So labyrinthitis would be like a vestibular therapy. And so we'll go through some of the treatments that you could use for vestibular labyrinthitis as well. Okay, so oculomotor, let's start with that stuff. So these are oftentimes when you're having issues with eye movements, such as like tracking an object. Like if you feel dizzy when you're tracking an object, if you feel dizzy when you're kind of looking at an object and looking at another object, that can be saccades. And then we're also going to look at gaze stability. So your ability to look at an object and keep your head still, or not keep your head still, sorry, to look at an object while moving your head and keeping your gaze still, right? So sometimes when people look at an object, their eyes will actually slip off of a target as their head moves. And so it's not something that you know is happening, but while you're moving around, it makes you feel pretty icky and maybe like sensitive to motion, or like you're off balance. You have this sense of disequilibrium, just kind of off. And so we'll go through those things. So let's look at smooth pursuits, shall we?
Sure.
So you need a target.
A target.
A
Gumby's
target.
right behind you and the skeleton
Perfect.
there.
Let's use Gumby. And the good things to have with a target are just something that has, like something specific that you can look at so that it keeps it in focus. So with Gumby, we're just going to look at his eyes. Okay. Now I'll have you try this, Mike. So you hold up Gumby there.
Okay.
And
Hi,
look
Gumby.
deep into his eyes.
He's not blinking. I'm going to lose.
He's not
eye
blinking,
staring
which is
contest.
good. Okay. So then about an arm's length out in front, elbow straight, you're going to just move Gumby across your field of vision, keeping head still, watching Gumby's eyes there. You feel like
how far do I have to go? As far as I can? Or
you
just-
can, but I usually don't have people like wrap around their head just because it's maybe going to cause more eye strain.
Okay.
So just kind of side to side in your vision that's comfortable here. And what the goal is that you complete this for about 30 seconds, which helps helps it get stored in your brain, right? That you've completed this task. And then that Gumby's eyes stay in focus, right? So if Gumby's eyes are really blurry, we're going to have you slow down. If Gumby's eyes are crisp, you can actually increase your speed a little bit
I
there.
feel like we're on the tilt-a-whirl on the carnival rides. You're spinning in circles. Or the teacups at Disney, That's what it feels like. The background's blurry, but he's in focus.
Perfect. Okay. You can also do this up and down.
But my head stays still.
Head stays still. And again, eyes are moving.
I feel like he's on a swing.
And you could try this, right? If it reproduces your symptoms while you're doing this, it's probably something you should work on.
And my eyes are getting a workout.
And again, I would say 30 seconds, maybe 3 times a day, each direction. And you'll notice too, some directions might be harder than others. And
Right.
yes, I'm seeing a question coming in from Margot. Could any of these cause nausea? Mike, you can take a break if you want.
Okay, thank you.
Are you getting nauseous?
No, but I'm getting a little. My eyes are working hard.
So yeah, these definitely can cause nausea. I saw somebody else saying that they have like, they've had a concussion and they're dealing with some of these symptoms. And so these exercises might cause symptoms, right? They might make your symptoms a little bit worse. And that's okay that we push into those symptoms a little bit, but you really don't want to like make your symptoms worse for a long period of time. So an example of that would be if you're doing this, it makes you feel a little bit nauseous, but then you rest, you take a break, and within 10 minutes that nausea goes away. That's okay. But if you do this, you get nauseous, and that nausea lasts for hours, if it ruins your day, right, it's probably too much. So you might need to start with even less. Like our goal is 30 seconds, but sometimes people can tolerate like 5 seconds. So it just depends. And again, this is harder if you wear glasses. So that's a good point as well. And depending on your glasses, you may need to take them off. If they're for close up distance, I usually have people just remove their glasses for these exercises. And also, then Mike was saying, how far do I go, right? You want to stay within your glasses lens if you are wearing your glasses. Otherwise, it's definitely going to get blurry.
So is the next one? I move my head.
So not quite yet.
Oh.
The next one we're going to do is saccades. So you need 2 targets. So let's use
Saccade?
Gumby and let's use your thumb.
What did you say? Saccade?
I said saccades.
Okay.
So it's just a fancy
there it is.
word for eyes jumping between 2 targets. Okay. So we want your eyes to jump between 2 targets there. And usually what I do for targets, honestly, is I take a piece of paper
I got
or a
mommy.
tongue depressor, and I have I just write like a little E on there or like an M or something like that. Somebody's saying no sound.
No sound. Can you?
I just write like a little. Okay.
We can hear us.
Yeah, we
Turn up your system.
looks like our sound is good to go there. But yeah, so let's jump, Mike. Head stays still.
Okay.
And we're going, what is that?
The mummy.
It's a mummy. So we're going mummy to Gumby here.
Okay.
And again, as long as it's something where you can look at. And sometimes with saccades, what people will struggle with here is they're either undershooting or overshooting. So Mike, if he looks at Gumby, his eyes might stop just a little bit before Gumby and then correct and jump to Gumby. Or he might pass Gumby with his eyes and have to jump back to Gumby. So if this makes you feel icky, that might be what's happening, right? You get a little bit dizzy or off balance or just kind of not feeling great. That can be part of this.
Can you do?
Yes, you can do up and downs. You can do diagonals. Again, you don't want these really far out. You want them to be within that field of vision.
Oh, this is work.
It
I mean,
is
I'm
work.
not dizzy, but
No. And if they feel fine, right, you probably don't have a problem with it and you probably don't need to practice these. Okay, let's try vestibular ocular reflex. So fancy words for your eyes when you turn your head might slip off of a target. Okay, so this one is smaller head movements. You're only going to turn your head about 20 degrees side to side, looking at that target, keeping it in focus. And sometimes I'll have people even use like a thumbnail, but you really want something where there's a little bit more definition so you can see if it stays blurry or not. What do you
Yeah.
think? Staying in focus?
yeah, I see Gumby's face. He's
So this
still
you can
smiling.
even increase the speed, right? So you can be really quite quick with this. It's really like back and forth,
Oh.
like this. If you can do it, right? If it's blurry, you're not going to do
Well,
quite
that
as
makes it more
fast.
challenging. But now it looks like he's dancing.
And maybe you need to slow down a smidge. But also same thing. We're going to do up and downs. We're going to do side to side. And again, all of these that we're doing right here, 3 times 30 seconds, you're starting and sitting.
It's kind of funny. Yeah, he looks like he's moving around, but he's not.
I think you're going too fast, Mike.
Oh,
You're
okay.
going too fast.
Yeah, I'll go a little slower then. That was definitely a workout. I mean, I know Bob actually did these and his balance is getting a little worse, and he said these kind of helped with him. So
We're getting a question in too for motion sensitivity happening in cars, buses, And there are some treatments. It looks like you've been doing some drugs, some over-the-counter stuff probably, and ginger. And then there's some anti-nausea drugs too that can be prescribed. But we are going to get into motion sensitivity. So hold that thought.
Okay. Motion sensitivity. I'll hold the thought. I understood you there.
Good. Okay, let's also do, since we're seated here, let's do VOR cancellation.
There's one question I feel like
Oh,
I can
yeah.
answer. What does it mean when you have pain in your ear cartilage, having ringing and headache with weather change? I'm guessing that has to do with the pressure changes because normally with storms, there's bariatric pressure coming in and out. So that's more just pressure in your ear. So talk to the doctor because I don't really have a good answer for it, but that's why it's with weather changes. Anyway.
Yeah, that might be a good thing to bring up to your primary care. Okay, let's do VOR cancellation. So same thing. You're going to hold Gumby this time, and Gumby and your head move at the same rate. Okay, so this one you want to make sure you're kind of in a stable spot, feet flat on the floor, but you're going to rotate. Okay, so torso rotates. And you are keeping Gumby in focus. This is another one to work on.
Does this depreciate as you get older? Because I used to love carnival rides, and now I can go on them, but I feel kind of nauseated later.
Yeah,
It's more of a stomach nauseation, not like
I'd say that's
dizziness.
more like the motion sensitivity, right? Where you're like flipping upside down. And but this could get worse as you get older. This is actually more of a central function. So this has more to do with your brain than your vestibular system, but it will, if you struggle with it, working on it will help kind of make that feeling of being dizzy and icky improve.
What about when I was on a boat in the ocean for a while? A little one, a lot of waves, and then I felt like I was on waves the rest of the day.
Yeah.
Is that similar or is that different?
That's probably similar to that motion sensitivity as well, like carnival rides.
Sure.
Mm-hmm. Okay, one more that can help. So this one is called look turn, and it's exactly what it sounds like, right? So if you have trouble with that VOR, so you're turning your head back and forth and your eyes are slipping off your Gumby. Okay, eyes slipping off Gumby. You are going to do this when you're out and about in the community, but start in a seated position to practice it. So we're going to look with our eyes before we turn our head. So I'm going to look to my left. In front of me, there's a skeleton. What's that skeleton's name?
No, it doesn't. That's Dad to the bone.
Okay. Well, I'm going to look at the skeleton shirt and then I'm going to turn my head to it. And same thing. I'm going to find another target off to my left. I'm going to look with my eyes and then I'm going to turn my head. And that's going to help stabilize your gaze. So you just feel a little bit more stable when you are walking, when you're moving around. But again, practice it in sitting because it can be a little bit to get used to where you're moving eyes first, then turn head. Rather than when you see something over here, your eyes and your head move together. And if your gaze is not stable, they're slipping off targets, making you feel more nauseous.
That is. Do you want objects that are further away for this one?
So objects should be further away, maybe 10 to 15 feet.
Okay.
And they should also be like, when you have your head still, you should be able to see them in clear focus. So again, they can't be off too far from the side, but maybe like a 30, 40 degree angle out to the side so that they're something, and you can progress this one to walking too. So I do this one while taking walks sometimes, and I will like look at the stop sign, right? I'm going to look at a tree. So you look first with those eyes at the target and then move head, which can help a little bit.
Pretty soon you can look at the geese here because they're in your way.
Yeah, they're coming. They're coming. They're going to be hissing on the path as you walk past.
Okay, so is that it mainly for these type of treatments?
That's pretty much it for my oculomotor stuff. Was there any questions that came in specifically about these?
There's a lot of questions just coming in here.
Yeah, this is a huge topic.
Okay. We got one from Margot. When I mop the floor or do other movements that require back and forth motion while applying pressure, could this be crystal issues?
When I mop the floor, they require back and forth motion. So
I'm guessing head movement.
I mean, maybe potentially, and especially if it's like brief, intense episodes, typically characterized as spinning. So not everyone feels like it's spinning, but usually it's like a very brief, intense episode. So I would say probably not, but maybe. So the BPPV, the crystals, right, is or can be caused oftentimes, most often, by looking up, looking down, or rolling in bed. And so they're pretty big head movements, but oftentimes people like go to the hairdresser and they get their hair shampooed, right? Or they go to the dentist, and it's that same thing. It's that like extension of their neck that can kind of get those crystals moving where they shouldn't be.
Yeah, I don't know what getting my hair washed is like anymore. But anyway, I can
Yeah,
imagine
Mike
still.
doesn't. That won't be a problem for Mike.
We did have a question or a statement. I also have being on a boat sensation for 5 weeks now since I got from a cruise.
Oh my goodness. So I don't know the answer to that one, but I would probably go get checked out. I don't know.
I mean, mine only lasted a day, and it wasn't a cruise. It was a little fishing boat.
Right. Like I wouldn't think it should last for 5 weeks. So I would just get in, go get checked out, and make sure that everything is okay.
Does it matter if I choose to take off my glasses to do eye exercises, even though it's blurry?
Yes and no. So I would say if you can do the eye exercises with glasses on and make sure it's not blurry, that's going to make sure that your eye motion is good, right? But if the glasses are really causing a big issue, it would be okay to practice these even if some things are blurry. But really the blurriness tells you if your eyes are moving together, if they're tracking well, and if they're able to stabilize, right? And like look at that target. So the blurry versus non-blurry is an important part, but if for some reason it's like a big obstacle, you could practice with some blurriness.
Amber wants to know, does working on posture help with vestibular imbalance?
I would say yes, in some regards. So sometimes people with vestibular issues might have a hard time even like finding midline, right? So like if like one vestibular system isn't working and you've only got one functioning vestibular system, or this one is like 70% working, right? So it's not quite working as full. You kind of end up like an airplane with one wing. And so a lot of the times people will have like these weird postures, or they'll just like their head will be at an angle. And so working on those sorts of things, finding that midline, retraining, maybe in a mirror, giving yourself some feedback so that you can keep yourself upright does help with long-term solutions for that dizziness. Just kind of getting yourself back oriented in space can be very helpful.
Dove Angel wants to know, what about spinning sensation? I feel like a spinner on a game board, also rolling like a wheel.
Yeah, so that could be. I mean, spinning sensation, what that is vertigo, right? That's like the definition of vertigo, is just a spinning sensation. And it can be caused by multiple things. And so getting it evaluated if you're unsure, but oftentimes the spinning, those true spinning episodes, could be something like BPPV if it's brief. If it's longer lasting, it could be a sign of something else. So again, maybe getting that evaluated. You could try the BPPV exercises and see if they are helpful. If they are not, that might be a good indication that it's something else causing that.
We will be getting into the BPPV exercises next, but we still, boy, questions are just coming in. Why do I see stars when I head suddenly like, when I'm guessing move my head.
Washing your hair in the shower, and maybe you are doing some neck extension and seeing stars. I'm not sure exactly what's going on, but I often associate that with like a blood pressure issue, or maybe even like a blood flow issue. So, like that's almost like passing out or those sorts of things. So again, probably a good thing to discuss with your doctor and have evaluated as well. Just because if your neck is back in the shower and you're getting lightheaded or starting to see stars, like that's probably not safe, right?
It's normally blood pressure. Yeah. At times I don't lift as heavy as I used to in the gym, but at times I used to lift really heavy, and you purposely kind of engage your whole body and hold your breath to a point. And every time afterward, I would see stars and get very lightheaded, but that's because I'm dramatically increasing my blood pressure during the exercise. But that's
Yeah.
so that's
And
kind
I
of
see
blood
that
pressure.
there. Let's see. It's Jackie says that working in the garden makes my BPPV worse. Okay, so let's get into BPPV, right? And working in the garden can, because you're often tipping your head down. You're bending, doing a lot of bending. I had someone recently where they were doing tree cleanup, right? So they had brush after a tree had fallen. They're tipping their head forward. They're standing up. All of those things can make that BPPV worse. So let's get into it.
Sure.
Mike,
Yeah, there's a
you want to
bunch
be
of-
my patient here?
Guinea pig?
My
Is that the
guinea
word you're
pig?
looking for? Sure. What are we doing? Oh, booyah! Stick down.
All right.
What am I doing? Laying
You
down?
want to slide this out just a smidge so we
Sure.
good. Okay. Yeah. So I'm going to have you start by sitting in long sitting, which I know your hamstrings don't love.
Thank you.
So this is one that you can try at home. Actually, you can swing around for a minute because I'm going to talk. But you can try this at home. I want you to do it safely in like a bed, something that's probably wider than this, because this test is supposed to invoke your dizziness, that BPPV. So if you're dizzy, it's good to have a second person in the room or do it on a wide surface. If you are uncomfortable with these positions, I want you to just go in and have a skilled therapist do this for you. But if you're pretty mobile, if you think that, you want to try these at home, you absolutely can. Okay. The first thing to do too is to make sure you have enough neck range of motion. So you turn to the side for me, Mike, and extend neck back. So really what we're looking for is, do you have enough extension where you can get your neck back into this position? Because we're going to get your neck back just about like that. So 30 degrees back is what we're going for. If you don't have that, that's another good reason to go in for someone that does this as their job, because likely they're going to have a table that will tilt, and they can tilt the table rather than your neck. But your motion looks good, Mike. Let's give this a try. So back to long sitting. So this is the Dix Hall Pike, which is more of a, it's a test, not a treatment. Okay. So we're going to see, does Mike have BPPV? So we're going to start in this position. You turn your head 45 degrees to the right, and then you're going to lay down. Head's going to hang off table, Mike.
Okay.
And you want to get even further there. So we want that full, 30 degrees of cervical extension. You hang out here. Okay. If you get dizzy, breathe, know that it will go away, right? Because if it is BPPV, it's going to be short lasting. It's not going to last all day. Probably, like I said, maybe 20 seconds. How's it feeling? You doing okay?
Yeah, my neck's tight, but I'm not dizzy.
Okay, so then go ahead, sit back up for me. So at home, if you can do this with head hanging off table, that's great. If you can't, we will also try stacking up a couple pillows so that they are kind of right on your upper back. You're going to lay back and do the same thing. So yep, head turns 45 degrees to the right, and then you're going to let that neck just kind of relax.
Oh,
So this works too, but is it putting more pressure on your back?
a little bit.
So if you have back pain, this one might be harder. So just keep in mind. But essentially, we're waiting for that dizziness to go away. So let's say that Mike is dizzy here in this position. Okay.
I'm dizzy.
Actually, I think I want to change. Can we change the arrangement here so people can see what you're doing from above?
Above.
I'm going to angle
Oh,
the table.
Yeah, we can do that.
So they can.
I thought you meant like the ceiling.
We're going to go right like that. Okay. So I'm going to get rid of these pillows. We'll do it without the pillows.
I still going to the right.
Yep. So we're going to say that his right ear has a problem. And honestly, a majority of cases are right posterior canal, which is what we're looking at right now. Okay. Yep. Good. So Mike is dizzy here. Whoo-wee. So he's just breathing. He's letting it resolve. Okay. Once that dizziness resolves, you need to wait 30 to 60 seconds. Okay. So we'll say it's been 30 to 60 seconds. You're going to turn your head to the opposite side. Same. So 45 degrees, and then let that neck extend. Same thing here. we're going to wait because there might be a little bit of latency or time before that dizziness starts. Once that dizziness starts, you're going to breathe, hang out there, make sure you're in a safe position, and then wait that 30 to 60 seconds. Now from here, he's going to roll onto this shoulder and neck is going to be facing down towards floor. Yep, just like that. And then this position often will recreate some of that dizziness. So making sure, like Mike is really on the edge here. So if you're at home, right, like we want you to be safe. I would even have a second person with you here, just making sure, because when people get dizzy, right, it's scary. It throws your balance off, and you really just want to make sure you're doing this in a safe spot. Okay, so the next position that I have people do is press up into a seated position. So you're actually going to swing legs off table, and I have you keep chin tucked into that shoulder for the first moment at the top. So he comes up to sitting, not raised shoulder, just bring. That's a common thing. People want to like bring their shoulder, but really it's about the neck position here. And then you're going to come up to that neutral position here. Woohoo! And that's the most common ear that people have this is that right side, that right posterior canal. So if you have BPPV, this is a good one to try. Let me see here. Any other questions? You want to help me look for some?
That one is just a test though, correct?
Well, so that was a treatment and a test.
Okay.
Sorry.
So
I did say it was just, yeah, the treatment was the rolling. The first test is when you sit up, lay back with your head 45 degrees and turn to the right and then extend it at the bottom. So if you get dizzy there, then you follow through with that.
We know if cataracts contribute to lightheadedness. I don't know.
I don't know that either. I would say probably not, but I honestly don't know. Yeah, I mean, I would say it could contribute to dizziness though, right? Those halos and the lights in the stores.
Callum says I found the water in the ear test by a doctor the best way to distinguish between BPPV like symptoms, spinning versus rocking dizziness. It's hard to explain exactly what dizziness is, I have found.
Yeah, and so that's I believe that's called caloric testing, and where they put different temperatures of water in your ears, and they actually can kind of tease out if you have a hypofunction. So like a hypofunction just means one side of your vestibular system, right? You've got, I'll put this one on, right? So you've got one of these guys on each side of your head. And so one of them might not be working as well. And so that test where they put the water in your ears can help determine where your problem is, right? They can say, oh, your left ear is not working as well as your right ear. And so that is a good way to test that out. Especially if you're struggling and you've been treated for a while and you don't have a diagnosis, there are a lot of tests that they can do. I think usually those are done by ENTs, those ear, nose, and throat docs.
Diane just says, why does one sometimes get dizzy after getting up from lying down on the floor doing exercises?
So that can be caused, it may not be, but it often is caused by orthostatic hypotension. Again, just a fancy word that means blood pressure drops, right?
Position changes.
Position changes, yeah. So if you're laying flat, you sit up quick, that blood pressure drops, and it takes a minute for your heart to pump it back up to your brain.
Can even happen sitting to standing sometimes.
Absolutely. Yep.
If you know what happens, the best thing is to just like kind of stay still and let it settle before moving.
Yeah, staying near your chair, right? Or like if you're getting up from the floor, maybe you sit up before you stand up from laying down on the floor. That would also help.
Yeah, and Elaine says it also happens at the hairdresser when you're getting washed because you like extend into the sink. I don't know why they don't fix this.
So,
I mean, yeah, you go into so much extension. I guess they know how to do BPPV testing at the hair salon then.
Okay, well, let's keep moving because we only have a few minutes, and I did want to talk about
Oh, we did have one person say B. Jane, if you watch earlier in the video, it's BPPV, not BBBP.
Yeah, so it's benign, meaning that it's, it doesn't cause issues. It's paroxysmal, meaning it comes and goes. It's positional, which means that it has to do with your head position. And then that V means vertigo. So that is what it is. And again, you can go back in the video and watch more on that as well.
Yeah, anyone watching this, you can rewind it at any time. And then you can rewatch it anytime. It'll be on YouTube indefinitely. And you can skip past the internet outages too. Anyway, do you want to talk about motion sensitivity?
I sure do. So motion sensitivity, I can't remember who said earlier, but they were talking about, in cars, in buses, those sorts of things where they're getting motion sensitive. It can also happen in busy stores. And so some of those exercises that we talked about already, which is like the gaze stabilization, can help. And then also it's more like graded exposure. So it's actually, you need to do small amounts of the activity that makes you motion sensitive. Try not to take those meds if you're working on improving your response to that motion sensitivity, right? But maybe you can ride in a car for just a couple blocks, right? You push into those symptoms and then you let those symptoms completely calm down. So I'll have people I give people homework. I need you to go into a store and walk around and look at the things in the aisles, go at 5 p.m. when it's busy, and just gradually expose yourself to those things. That can really help. And then also people that get really motion sensitive to daily activity, you got to keep moving. And I think people will tend to just want to lay flat, right? I'm not going to move at all because I am so sensitive to motion. And so just improving your motion sensitivity. Also, I didn't bring it, but I have certain fabrics, this is kind of hard to see on the video.
She does have certain fabrics.
I have certain fabrics. So this doesn't have quite enough contrast.
They look like a maze.
These fabrics, you can get all sorts of different ones that kind of make you feel like you're moving. And so I will put people into corners where they have just some really stripy fabric or even just really busy fabric, and then have them do things in that corner. I'll have numbers in the corner. And so you'll have to reach to the numbers in specific orders. Sometimes too, if you're more high level and you can do treadmill activities, sometimes I'll put people on a treadmill and then you have the fabric in front of the treadmill. So you're moving while you're also having to look at that fabric and maybe find numbers or find pictures or something like that. So there's all sorts of things that you could try for the motion sensitivity.
I know we didn't really get into balance activities you can try. Chelsea, who is running behind the scenes, can just link some of our balance videos. We have an endless supply of balance videos you can try. But with a lot of them, you just kind of have to be cautious and make sure you're safe with them, especially if you have, vertigo type issues that can get flared up. But some of these people, it seems like some of their balance issues may not be that, and you can certainly try a lot of those activities.
Yeah, and other things to think about too. So if those exercises that we did earlier, with Gumby, right? If they become easy, you can always do them in different positions. I want you to start seated, but you could then do standing, right? And you could even do a marching or walking with some of those. And those are good balance activities as well, as long as it's safe, right? So I want you to make sure you're not having a loss of balance when you're doing those activities, which is why we start seated, right? Make sure it goes okay in sitting first, and then have something to hang on to. Will really help with those as well.
Well, Kathleen says if I get vertigo and lay down, I start to vomit. Oh, well, yeah, I guess she knows not to lay down then.
And that could be, Kathleen, that could be BPPV. Sometimes BPPV is so extreme that people do throw up. And so that could potentially be treatable. And that's the other thing. Dizziness is so debilitating. I mean, people stop doing the things that they love because they are dizzy, right? And so I really do want to advocate that people go in and get this checked out. and, see some specialists on this. Make sure you're getting a diagnosis. It can take years. I've had people years where it takes before they kind of figure out what the problem is. But there are things that help. Vestibular therapy helps. What we've gone through today can help. And BPPV, we can completely clear it, right? It might come back, but like we can get rid of it. Don't just deal with it. Like, seek out some help for that, because it can really be beneficial to your quality of life.
Some people, even if they don't use an assistive device, meaning a cane or walker, sometimes just having one with, if you know you get the dizzy episodes, can help, because you can at least stabilize if you are out and moving about, or you could possibly take a break if you have a 4-wheel walker with a seat on it. So if you already, have one, make sure to use it, just because it can be a good safety measure. Or if you don't have one, maybe just use it temporarily until some of these symptoms go away, just so you feel safe. Because I feel like, people don't want to go out because of their possible dizzy episodes. So it's kind of one solution to that, or just going out with someone else, being there to make sure, you don't fall over. Anyway, is there anything else you want to address?
Those were kind of the big things. Are there any other questions that needed to be answered here?
There's a
Any
few.
last minute?
Sure. Is there a connection between BPPV and vagus nerve?
I don't know the answer to that either, but I would say, vagus does so much. I don't think they're directly related, right? But I think if you have BPV, could it affect other things? Absolutely. I think it affects a lot in your body.
If you are new to this channel, you can certainly subscribe. We put out videos 4 days a week on how to stay healthy, fit, and pain-free. And we are live every Tuesday at 10 a.m. Central Time. Brad will be back next week from vacation. He is somewhere warm while we are stuck in this blizzard here. Luckily, today it's a little clearer out, but Adrienne will be back in a few weeks and be popping in more regularly, so you can check her out in all her other videos as well she's done with us. Is there anything else you want to mention?
I think that's all.
All right. Well, thank you so much for tuning in.
Yes, thanks for joining us.
And we'll be back next week.